Hey class, welcome back. So this is our part 2 of our chapter 21 therapeutic drugs. This section of the recorded lecture is going to go over the important drugs that I would like you to focus on. You'll notice in this chapter that it does give a lot of mechanism of action, absorption, metabolism, excretion, and toxicity. There's a lot of information to this, and we're going to try to narrow this down because there's a lot of drugs. I don't expect you to be pharmacist. So I'm going to give you some very specific things that I would like you to study, and hopefully that will condense this chapter a little bit more for you. Okay? So hopefully that'll help. All right, so when we're talking about naming drugs, when a drug manufacturer designs a new drug, like OxyContin, they patent that drug, and they are the only company that can produce that drug. So they get that trade name assigned to them, OxyContin, and their patent. I think the internet said that it's good for like 20 years, that you can't have generic drugs from your formula for 20 years. So that's quite a long time to make a lot of money. And that company made a lot of money on OxyContin. So with naming of drugs, you're going to see within this chapter, there's several names for the same drug. And that's when we come into the trade name of the drug. We've got generic. Oftentimes, drugs are named after their chemical structure. For like acetaminophen, that is Tylenol. Salicylate is aspirin. So there's a lot of, you've got to know both of these names because the nurse is going to call you and say, well, I need a Tylenol level. How do I order that in the computer? Because in the computer, it's not going to say Tylenol, it's going to say acetaminophen level. So anyway, just be aware, the trade name is the name that the drug manufacturer gives itself, and that's their trademark name. So trade name, trademark. Most facilities go by the generic name, like Bactrim is, for me, it's T/S, and for an antibiotic, but we always just call it Bactrim. All right, so let's start with antibiotics, my favorite topic. There are just a couple that I would like you to know. So because these are measured in the chemistry department. Now, if you'll remember, if you haven't been through micro, let me give you a quick summary. So when a patient comes in, we'll culture them. We'll give the physician an ID and sensitivity, and on that sensitivities, there's multiple antibiotics that the physician can choose from. Of course, you're going to want to choose an antibiotic that's susceptible, but there's usually several different antibiotics to choose from. There are some antibiotics that are going to be IV antibiotics, and those IV antibiotics need to be monitored for toxicity. Okay, so these are the big ones that we're going to be talking about. So hopefully we all know, if you don't know, antibiotics are going to disrupt that bacteria. A lot of times it's the cell wall, but it also can affect the inside of that cell to break it apart. So that's what antibiotics are designed to do, is to target those particular bacteria. All right, so there's going to be the aminoglycerides. This group of antibiotics are mainly going to be your gentamicin and tobramycin. Okay, these are given through IV, and they're often drawn at a peak level. Remember, we talked about in that last video about trough being 30 minutes before and peak being after. So just make sure you know that. All right, so I don't want you to I just don't want you to focus in so much on this, all this crazy absorption and metabolism. If this interests you, I'm so glad. But just know a lot of your test is knowing just this is an antibiotic and this is its function. Okay. So you're going to have some classifications. So I would make my notes and I would say antibiotics. These are the antibiotics I want you to know. So in this first group's gentamicin, tobramycin. We're going to get to the epileptic drugs. We're going to do anti-tumor drugs, antipsychotics, immunosuppressants, for bronchial drugs, and then cardiac drugs. So there's going to be, let's see, 1, 2, 3, 4, 5, 6, 7 classes. Okay, so in this, just know antibiotics, we need gentamicin, tobramycin. They are highly polar cations. They're absorbed through that GI tract. And peak concentrations are 30 to 90 minutes. Just, again, toxicity is an issue that needs to be dealt with. Your kidneys are going to be highly affected by this. All right, so there's amikacin. It's going to fight your gram-negative rods. And then your gentamicin. Gentamicin are often given to babies, and they'll do a peak on the newborn. We're not seeing it as much fighting Pseudomonas anymore because CLSI has taken gentamicin away from Pseudomonas aeruginosa. That just happened in 2023. So that's a pretty remarkable change. We don't usually see CLSI take an antibiotic treatment away. So that's pretty significant. And then tobramycin, that's going to be treated for Pseudomonas. If you'll remember, Pseudomonas it can be very resistant to a lot of antibiotics. So there's only a couple things that can treat Pseudomonas. All right, so vancomycin. Here's one that I really want you to know. It is going to be used for those staphs. If you'll remember MRSA, if that is a new term for you. So Staph aureus is an organism that produces a toxin that does a lot of damage. There's this resistant bug out there called MRSA. It's methicillin-resistant Staph aureus. So it is resistant to one of the antibiotics that we use to treat Staph aureus. Well, over the years now, it's become resistant. And I'm sorry if you've already had micro. That's a quick little summary. So patients that have MRSA are often treated with vancomycin. Vancomycin could be very toxic, especially to our elderly patients, and it needs to be monitored. A lot of times they'll give vancomycin in a combo in another set of drugs on top of it, but it is given IV in the antibiotics or through a PICC line at home. But it needs to be monitored. Usually it's 3 doses, and then they'll do a peak to make sure your kidneys are clearancing the drug. Because what happens is if your kidneys aren't totally functioning well, they can get up into that toxicity range, out of that therapeutic range. Remember, I posted a little YouTube video, and you're out of that therapeutic range and you're up into that really toxic, damaging range. And it can have a lot of bad effects on your kidneys. So let's summarize that. If you have MRSA, the best treatment for MRSA is our antibiotic called vancomycin. There he is, fighting Harry Potter and Voldemort. Vancomycin. Vancomycin is going to win, hopefully every time. So there's some absorption, metabolism, and excretion, if you would like to read up on that. Okay, so our next big category is going to be our epileptic drugs. So this is our anti-seizure drugs and anti-convulsion drugs. A lot of patients that are put on this it's one of the medications that you're going to have to continually take for the rest of your life. It does have to build up to a certain level. It's not something that you can take right away and it be effective. All right, so here we go with our two names. This one I'm not so concerned with the two names. I'm going to give you specific ones I want you to know both names. Phenobarbital, we just call it phenobarb. It is a sedative and a hypnotic. It is used to relax you, and you just need to know or phenobarbital on that. All right, here's one that you're going to need to know both names. So phenytonin is its main name, but it also goes by Dilantin. We use Dilantin a lot of times. The nurse will call you, so you've got to know both names, and it's phenytonin and Dilantin. So with Dilantin, that is going to be used to treat grand mal seizures. See this first line right here, grand mal seizures. That is its main use. So phenytonin, Dilantin. You're going to need to know both names, please. All right, here's another one, valproic acid. It is called, we call it Depakote or Depakine. So most of the times nurses will call it Depakote. So again, that is a name that you're going to need to know both. So make sure you highlight that and write that down. All right, I want to say carbapenem, but that's not right because that's my antibiotic. Carbamazine. Carbamazine is also known as Tegretol. Those are the two names that you need to be specific. It is one of the anti-epileptic drugs, but it's also used to relieve pain associated with trigeminal I can't even say that, neurologica. I don't even know what that is. But again, another treatment for seizures. I did read that some of these seizure medicines can be used in like relationship with each other. Like they put them on more than one. All right, so this one's not used as much. Now, the first ones that we went through, so let's wrap it up. Phenobarbital, phenytoin, valproic acid, and carbam. All four of those are commonly measured in a hospital lab. Okay, some of these other ones aren't common, but just know that they're in this category. Okay, I don't need you to spend too much time looking at it. Primidone, that's another one. That's a psychomotor seizure. That's what it's controlling. So if you want to put that in the comments by primidone. Topramat or Topramax is its name. Again, that's not a very common one. Keppra. Let's look at Keppra. So Keppra is another one of those grand mal seizures. It has two names, so make sure you know both names. Levetiracetam. I don't think I've ever called it that. I always just call it Keppra. And most of the times the physicians are going to do Keppra level. So just know that is used for partial seizures in adults and children. It's that tonic-clonic seizure and monoclonic seizures for juvenile. I think this says grand mal, but you know that grand mal seizures, that is your really big one. But the one that's treated for grand mal seizures is going to be your phenytoin, which is Dilantin. All right, time for a quiz. Okay, so hopefully you got your quiz right. Phenytoin is Dilantin, and it's grand mal seizure. So that's what I need you to know. All right, so we finished antibiotics, anti-epileptic drugs. Now we're going to do some quick, like couple more that just have one drug in them a piece. So this is anti-neoplastic drugs. This is going to be a drug used for cytotoxic anti-tumor therapy. So kind of like a chemo type drug, like often used for megaloblastic leukemia. So for you guys that have been through hematology in adults, alone, it's rare. It's effective in the treatment with acute myeloblastic leukemia. Hopefully that name sounds familiar. But this is drugs they can take it home and without, like, not like chemo that has to be given IV. This is more like bone marrow type neoplastic. All right, so that is our one and only drug for that. So antipsychotic drug, there's going to be one, and you don't need to know both names. It's just lithium. With lithium, it's used for treatment of manic depression. And remind me to tell you about my lithium story, but make sure you're drawing that in the correct tube. Because if you have a green top that has lithium heparin in it, that's going to not give you the correct results. So remind me when we all get together, and I'll tell you my personal lithium story. It's a doozy. All right, so there's also bronchodilators, are another classification. Bronchodilators are going to open up those lungs. It's called theophylline. So you don't need to know the other two names, just know theophylline. That is one of the drugs we do run in the hospital to see. And it's not one that you spray. It's going to be a pill that they are assigned. All right, so there's cardiac. This is our next classification. The big one coming out of this is digoxin. It's very common, and it's used to treat cardiac issues. Sorry, I had the cough. Cardiac issues, mainly to treat heart failure. So a lot of cardiac patients are on digoxin. It does have another name, but you don't need to know that. And there's going to be a couple more in this category, but they're less common. So there's lidocaine and procainamide and quinidine. So just know those four are just in cardiac, but digoxin is our most common one, and that's one of those that the hospital will have on hand for you to run because it is common to be toxic with digoxin. All right, so our last category to wrap this up is our immunosuppressive drugs. So you have gotten your new kidneys because your kidneys have failed, so you've gotten an organ transplant, and now you've got to be on some kind of immunosuppressive drug so you don't get rejected. So there's going to be two big ones that I want you to know. Cyclosporin, and you just need to know the name cyclosporin, and tacrolimus. And it's tacrolimus also goes by Prograf. I see that a lot, so make sure you know both of those names. There's another one coming up. Yes, that one. Sirolimus, but that's less common. So let's go back. So cyclosporin A, it does, look at this, it selectively inhibits proliferation and activation of those T cells. So for all you guys that just went through the serology, that should sound familiar, right? So cyclosporin, remember what it does on this particular one. Tacrolimus, I'll tell you, one of the years I put tacrolimus on the advanced topics, I had 0%. Nobody got it right. So tacrolimus is an immunosuppressant. It also goes by Prograf. So now that you know I use it, make sure you know tacrolimus. And then sirolimus, we don't really use that too much and monitor that. All right. So our last little slide here is just going to cover how do we measure these things. They're measured in different methods. So immunoassays, gas chromatography, liquid chromatography, and then mass spec. All right, so I know that was a quick wrap up. There's a lot more involved in this chapter, but really I just want you to know the names of these drugs, which category they're in, and just some of the key things that I've said along the way. And I think you're going to be fine. Okay, thanks for watching.